So we are looking at this diagram. Okay, so this is what we call a diagram of the female reproductive organs. So this is called, so if I point here, this is the uterus. So you see this entire structure here is the uterus. Okay, learn how to draw, especially the midwives. Okay, learn how to draw, practice it. Learn how to practice it. Every day you can draw. Every day you can draw. Every day draw until you become perfect with drawing it. Okay. Then, so you see, there's the uterus. Now, I told you the other time that the inner part of the uterus, we call it endometrium. Say it. Say endometrium. Say it. Say endometrium.
Endometrium.
Say it again. Say endometrium.
Endometrium.
Pointy arrow biya babetache inside na. Sa arrow sa label ni friend endometrium. Okay, the inner lining of the uterus, we call it into some pointy hakra ha, some pointy hakra will be label endometrium. Okay, but a pointy be a better uterus and will be label uterus. Now, if we point the middle layer we call it a myometrium. Say it, say myometrium. Say myometrium. That's so myometrium is the middle layer of the uterus, myometrium. And then the outermost layer here is not here, but the outermost layer of the uterus, we call it perimetrium. Say it, say perimetrium.
Perimetrium.
Say baby to say ha. Me point baby to say ha. Ha. Baby, I'm a point. Ubet me a lebon perimetrium. Peri means surface. So perimetrium. Okay, so the uterus is made up of how many layers? 3 layers. The innermost layer, we call it endometrium. The middle layer, we call it myometrium. The outermost layer, we call it what? Perimetrium. You see how it goes? Very simple. Okay, so the inner layer is called what? Endometrium. Middle layer is called what? Myometrium. Outermost layer is called what? Perimetrium. Is that okay? Then here, you see, this entire structure is the uterus. This entire structure is the uterus. And you say, I see her, fiha no mubi see her, a friend is service. Okay. Now, you see that there is an opening between the cervix and the uterus. Your tokro bia, ufi sa tokro na, ufi cervix ni ma, ufi hua na oko uterus ni. We call that eternal os. Say eternal os. Say eternal os. So when we say eternal os is the opening between the cervix and then the uterus. The opening between the cervix and then the uterus. That is what we call eternal os. And then here, you see from the cervix, you are going to the vagina. From the cervix, you are going to the vagina. The opening between the cervix and the vagina, we call it external os. So in exams, we can put a statement like, okay, that refers to the opening between the cervix and the vagina. What would be the answer?
External os.
External os. Then we can also ask you a question. That refers to the opening between the cervix and the uterus. What would be the answer?
Internal os.
Eternal os. Into your eternal os, opening between cervix and uterus, and your friend internal os. You can external os, opening between the cervix and the vagina, external os. Is that okay? Yes. And the midwives, especially, you have to know some of these terms. Especially when you start with obstetric anatomy, some of these things will help you. There are things they'll be asking you questions on. Okay. So when we say internal os, the opening between the cervix and the uterus, external os, the opening between the cervix and the vagina. Yes, please. Yes, please.
The os, is it orifice or what?
Oh, yes. Os simply means orifice or opening. Okay.
Opening.
In anatomy, when we say os, it simply means orifice or an opening. Okay, so when we say internal os, that is the orifice between or the opening between the cervix and then the uterus. External os, the opening between the cervix and the vagina. Is that okay? So know the internal os and the external os. Okay, so if we bring this diagram, here is what we call the vagina. So this is a simple diagram that if we bring in exams for you to label, you shouldn't miss it. Okay, so here, this is the fallopian tube. This fallopian tube. This is the ovary. This is also ovary. This one is uterus. Okay, the uterus, the inner lining of the uterus, endometrium. The middle layer of the uterus, myometrium. The outermost layer of the uterus, perimetrium. And then here is the internal os. Oh, they are in your slides already, please. You have this in your slides. So if you don't have, you can't see from here. Usually, sometimes it's the network. Follow along with us in your slides.
Yeah.
Yes. All right. That is fine. So we have the internal os, we have the external os, and then we have the cervix. Then this is what we call the
Please, I have
vagina.
a question.
Go ahead. Go ahead.
What's the difference between the uterus and the womb?
The uterus and the womb.
And the womb is uterus.
Oh, it's the same thing. No?
Yes, sir.
There
It's
is
the
no
same thing.
difference. There is no difference. Why? Yes, there is no difference. The uterus is what we call the womb. Is that okay? Yes. So the uterus is what we call the womb. Just that the womb, where the baby actually lies, the baby lies within the endometrium. Is that okay? We use the term womb to refer to where the baby actually lies. The baby lies within the endometrium in the uterus. Is that okay? So the uterus is basically the womb where the baby lies. Okay. All right. But that is not the technical term we use. We don't use womb. We use uterus. Okay.
Yeah.
All right. Yeah, that is fine. So this is what we call. What's the name of this diagram? What did I say about this diagram? What's the name?
The
The
vulva.
external female genitalia.
Good. External female genitalia, or you can call it the vulva. So in exams, yeba na me ka say draw the vulva. Now could draw be different. You have a problem. If we ask you to draw the vulva, this is it. If we ask you to draw the external female genitalia or external female reproductive organs, this is the diagram we want you to draw. Is that okay? Yeah, so now let's look at this diagram. So you see, this is this part of the external female genitalia. Yes, who is that?
Please, can you, is the urethral opening also known as urethral os? Because
Oh,
when
but madam,
the
we are now
person was
coming there and you are jumping us there. We are now coming to that area. We are not coming there. We are coming to now talk about urethra. I've not mentioned urethral. Unless maybe you want to talk about the male. But for female, I have not spoken about it.
hey, like the other name.
For
Can you also say urethral os?
but
Or
you
is
can call it
opening
urethral os, please. You can call the urethral meatus urethral os. It's either urethral orifice. Is that okay? We only use the os for the cervix, the internal os, and then the external os. These are terms that we only accept and use for service. Is that okay? Because the os means orifice, you can't say urethra os. No, we don't use that. All right.
Yes.
That's fine.
Sir, please, I want to ask a question.
Come again?
Sir, please, I want to ask a question.
I can't hear you, please.
Sir, please, in the vagina, what causes menstrual cramps in the vagina? Since it's the place females have their menstruation from.
Oh, what causes menstrual cramps in the vagina? Is that a question you are asking?
Yes.
Oh, menstrual cramps is not really coming from the vagina. The cause of menstrual cramps is not coming from the vagina. It's coming from the menstrual cycle process. Okay, just that we have something we call, pain radiates. Is that okay? And when it comes to pain sensations that you experience during menstruation, the effects can be sensed within your vagina. That doesn't mean the problem will be coming from the vagina. Okay, yes, and I also see the answer. You mentioned menstrual cramps, meaning the cause is there from the menses. Is that from the menstrual process? Is that okay? Yes, just that you may experience, some women may experience vaginal pain during that process. Okay, but that the problem itself is not coming from the vagina. Is that it's coming from the menstrual cycle process. All right, that is fine. Okay, so let's look at
Please, I want to
the
ask a question.
oh, what is the question? Go ahead, please.
Please, the last time you said something about the endometrium. You said when pregnancy takes place, like when a
All
woman
right.
is pregnant, the endometrium changes to be something else. Please, can you touch on that again?
Oh, that is decidua. We've mentioned
Okay.
that several times. So
All
I
right.
mentioned that then the endometrium, when a woman gets pregnant, you can't call it endometrium. You have to call it decidua. Is that okay? When we say decidua, it's an endometrium that is rich in terms of blood, okay, and then in terms of nutrients. That is what we call decidua. If a woman gets pregnant, the endometrium, you can't call the endometrium of the uterus endometrium. The name changes and we call it decidua. So when
Okay.
we say decidua, decidua is the endometrium during pregnancy, an endometrium that is rich in terms of blood supply. That is what we call decidua. So
Okay.
if it means that you only have decidua in a pregnant woman, simple as that.
Okay.
Simple as that.
Okay.
All right.
Thank you very much.
Okay, so this is what we call the vulva. This is the vulva. Okay, so the vulva here, this part, we call it the mons pubis. Say mons pubis. Say mons pubis.
Mars
Mars
pubis.
people.
For the vulva, we have folds. This part, we have outer fold. The outer fold, okay, that is what we call the labia majora. And then we have an inner fold. The inner fold is what we call labia minora. Okay, or you can call it inner fold. So another name for the labia minora, we call it inner fold. Okay, then the outer fold, we call it labia majora. Into you can labia majora. Another name for labia majora is outer fold. Okay, more like the outer skin of the vulva, the outer skin. Okay, so if you are looking at the vulva, you see the outer skin. We call that the labia majora or outer fold. Then we have the inner fold. We call that labia minora. Okay, then this is what we call the clitoris. Okay, this is the clitoris. Here we call this one the urethral meatus or the urethral opening. Here, this one, urethral opening or urethral meatus. Okay, then this is the vaginal opening. This one, vaginal opening. Okay, then the area where we have this area, you see the area where we have the urethral opening and then the vaginal opening, this area here, this area, look at where I'm going around, this area, we call it vestibule. So when we say vestibule, vestibule is the area in the vulva where we can locate the urethral opening and then the vaginal opening. Okay, let me take it here. So look at, this is it. So you see, this is what we call the urethral meatus or the urethral opening. And this is called the vaginal opening or the vaginal orifice. Baby, ubetimi locate region of the vulva na, that circular or oval region of the vagina na, ye betimi locate urethral meatus. Ye betimi nso locate vaginal orifice no. Sa area no, and your friend vestibule. Into the vestibule involve, we are talking about the region where we can locate the urethral meatus and the region where we can locate the vaginal orifice. So our region in your friend vestibule. Is that okay? Yes. So pay attention to that. So here you see this area here. This is where we call the vestibule. So say if I point here is vestibule. If I point here too is vestibule. Provided that region, okay, so the vestibule is like a region. It's not like one particular thing we are pointing that this is vestibule. It's a region. So the region within the vulva where we can immediately locate the meatus and then we can also locate the vaginal orifice. That is what we call the vestibule. Okay. Then this is what we call the Clitoris. Say clitoris. This is what we call the
Clitoris.
clitoris. But the clitoris
Clitoris.
has parts. Oh.
Clitoris.
Clitoris.
Yes, the clitoris has parts. Okay, so you see, this is called the glans of the clitoris. You see, the topmost part of the clitoris, we call it the glans of the clitoris. The glans. Say glans of the clitoris.
Glance of the
Hands of
clitoris.
the
Of the
Say
clitoris.
it again. Say
Glance
clitoris.
of the
glans of the
clitoris.
clitoris.
Glance
Glance
of
Glance
the
of
of
the
the
clitoris.
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 Part of the clitoris. The topmost part now called joining or body. No. In say clitoris, no topmost part, it goes further to go and join your body, your mons pubis, your perineum, your mons pubis. That topmost part of the clitoris, we call it the prepuce. Okay, say it. Say prepuce. Say it. Say prepuce. Uh-huh.
Prepuce.
Good. Say prepuce of the clitoris. Say it again. Prepuce of the clitoris.
Prepuce of the
Prepuce
clitoris.
of the
Of the
clitoris.
clitoris.
Then the lower part of the clitoris, we call it the frenulum of the clitoris. Clitoris and asieno. Asieno. Your friend frenulum of the clitoris. Say it. Say frenulum of the clitoris.
Frenulum of
Frenulum
the
of the
clitoris.
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 In exams, your mouth diagram we near pointed clitoris in a swa. And also a label in a glance of the clitoris. You pointed a straw. Prepuce of the clitoris. You pointed a paper frenulum of the clitoris. Okay, so this is called the glans of the clitoris. The topmost part of the clitoris we call the prepuce of the clitoris, and then the downmost part of the clitoris we call the frenulum of the clitoris. Okay, if you frenulum now, oba se kakra bi ente ha, unsa eha ene ye wo urethral meatus. Ene wa ha, nti unse frenulum ni. Oba se kakra bi abe locate vestibule no, ubon se ye wo urethral meatus. This is the urethral meatus. Is that okay? The urethral meatus. Urethral meatus nenchen. Unse urethral meatus nenchen eha. Unse urethral meatus no ne side to the right. Your gland be or ne side to the left. Your gland be or into urethral meatus no almost side ne side no. Your gland be or your friend a paraurethral gland. Say it. Say paraurethral gland.
Urethral
How are
gland.
you, Ishra?
Urethral gland.
Say it again. Say paraurethral gland.
Urethral gland.
Urethral gland.
Gland.
That gland, you can also call that gland the Skin's gland. Say it. Say Skin's gland.
Skin.
Skin gland.
Gland.
SKENE, Skin's gland. Say it. Say Skin's gland.
Skin gland.
Say
Gland.
paraurethral gland.
Urethral gland.
Gland.
And is that it produces a special kind of fluid that actually cleanses the urethral opening. Because you see, females are at higher rates of infection because their urethra is very short as compared to males. So this paraurethral gland, what it does is that it produces a special kind of fluid that cleanses, okay? It cleanses the urethral opening. And it also ensures that the urethral opening remains moist. Send a better urethral opening and yet dry. A yet dry or ban obenya problems. Into your paraurethral gland no urethral meatus no
How is function?
omo urethral meatus ne side into urethral meatus ne right side no back wo and in the left side no so back wo eha this side eha nchen ha back wo and nchen ha so back wo you from para meaning they are parallel to the urethral meatus tin you from say paraurethral gland meaning they are parallel. How many urethral meatus? Some were the same line. So there are two. So the paraurethral glands are two. We have one on the right, one on the left. What is their function? They produce a special fluid that cleanses the urethral opening and also ensure that the urethral opening remains what? Moist. Is that okay? Keep that in your mind. Now you see the vaginal opening too. Vaginal opening is on the side. Your glands may know. Your from battle lens gland. Bartholin's gland during sexual intercourse, during sexual arousal, the Bartholin's gland actually produces the lubricating fluid. Okay, that sort of provides lubricating effects during sexual intercourse. And a friend, a Bartholin's gland. Is that okay? So the Bartholin's gland, where can we locate the Bartholin's gland? The Bartholin's glands are also located closer to the vaginal opening. Into vaginal opening in here. The right side, your Bartholin's gland back wall. The left side, your Bartholin's gland so back wall. Your Bartholin's gland back wall, your Bartholin's gland back wall. Saying, produce special lubricating fluid. And so during sexual intercourse, when romance is going on, is this gland that produces that initial lubricating fluid, that clear fluid, okay, that provides lubrication for the sexual intercourse. Okay, and your friend Bartholin's gland. Then we have the Skin's gland or para-urethral gland. What is the function? Is the para-urethral glands that, what it do is produces a special fluid that cleanses the urethral opening. Urethral opening, it cleanses it. Is that okay? And it also ensures the urethral opening remains moist. Okay, it doesn't become dry. If it becomes dry, there can be infections. It can cause abrasions and all of that, especially during sexual intercourse. Okay, yes. So that is it for the vulva. Okay, so if we ask you to draw the vulva, this is what you are going to draw. So you show the clitoris, the glands of the clitoris, the under, you show the frenulum of the clitoris, you show the prepuce, you show the mons pubis, you show the para-urethral glands or the Skin's glands, you show the urethral meatus, you show the vaginal opening, you show the vaginal opening or the vaginal orifice, you show the Bartholin's gland. Okay, we have one Bartholin's gland here, we have another Bartholin's gland over here. Then we have the anus. But look, you see the downmost part of the vestibule. Look at, you say, labia majora and labia minora. No. So, omo ba no mo be sia wasia. Sa aseɛ hɔ na ɔmo nyinaa bɛhyia no yɛfrɛ no faucet here, this part. So you see, this is the labia majora. It's coming down. It's coming downwards. There's another labia majora coming downwards. The minora is also coming downwards. All of them more like they are heading downwards. Okay. Now when they come over here, the down here, this part here, aseɛ ha no, yɛfrɛ no faucet. Say faucet. Say faucet. We call it faucet. So in a diagram, if we point anywhere here, look at this diagram. There's the real diagram. You see here the down parts. You see, we call it faucet. Faucet. And learn how to spell it too. So how I spell it. Okay. How are you going to learn how to spell? Constant writing. It won't come by magical. You have to keep on writing till it sticks. Or keep on reciting and spelling it till it sticks. There is no other way. The only way to do it is that you keep on practicing it till it gets into the brain. If you relax and wait during exam, some of these terms within a short period for it to work for you. So you have to keep on writing, reading. How can you do that? Buy an exercise book. Every week, try and make sure you at least write 2 exercise books. You learn, you write, you learn, you write, you learn how to draw. So you become perfect. Is that okay? Now, in between the faucet and then the anus, the space there, the region there, we call it perineal body. So in between the faucet and then the anus, the space here, this space, we call it perineal body. In between the faucet and then the anus, this space, so that space we, okay, your friend a perineal body. Yeah, someone wanted to ask a question. Who is that? Yes.
Please, I have a question.
Yes, go ahead and ask your question, please.
Please, my question is that, see, there are some people, their labia minor is outside, some too
Okay.
is closed. So I want to ask,
Yes.
is it that is it normal or they have problem with that one?
Oh, they don't have a problem. It's normal. Okay.
Okay.
Yes, it's normal. They don't have a problem. Is that okay?
Okay.
Yes, it's
Okay.
normal. If you take
Mm,
human beings, there are some of us, some people they are short, some people are tall. It's not
mm.
abnormal. It's okay. Is that okay? Yes.
Okay,
So
sir.
yes, we have some people that their majority to may be seen more prominent and then very huge. Some people to their own
Eh,
may be a bit leveled. All those things are normal. There are variations. That is why we don't have a fixed shape for or a fixed way or a particular way that the vulva is supposed to appear. Yes, someone also
Mm.
wants to talk. Yes, who is that?
sir, please, what my sister, the question my sister just asked, um, I learned
Mhm.
they said too much sex can cause that. Is it true?
Oh, too
Yeah.
much sex can cause the minora to become big.
Yeah. To come out.
Oh, I disagree. It's not true. Unless you are not seeing the minora is not the vaginal. Minora na the skin. It's like the skin of the vulva.
Mm.
It means that if you are looking at the vagina, the parts that you can actually touch, more like the skin where you have hairs growing, okay, not the inner parts, the outer parts that is getting to touch your body. That part is the majora. That fold is what we call the majora. Now, when we go inside, we have another one getting closer to the inner. That one is what we call the minora or the inner fold. Is that okay? And that has got nothing to do with sexual intercourse. The majora minora has got nothing to do with how much you are having sexual intercourse. Is that okay? Usually the misinformation has got to do with the vagina, where we have a school of thought that believes that the more you have sexual intercourse, your vagina begin to lose its elasticity and begin to expand and all of that. That is there. But it's a misconception. We have people who go around having been promiscuous and all of that, but the vagina remains intact. Okay, we have people who have even given birth 2, 3, their vagina remains intact and may appear normal, even as compared. But fine, we have, of course, infections and some diseases, can cause malfunction and then can affect the structure and appearance of some of these reproductive organs. Okay, so for example, an infection can cause your vagina to become loose.
Yes.
Is that okay? Yes, but not necessarily the majora and then the minora. Yes, please.
So another question.
Go ahead and ask.
So the question is, does the hymen determine virginity?
Oh, the hymen break can occur not only as a result of sexual intercourse.
Mm.
It's not only sexual intercourse that can cause the hymen to break. Do you get? You can have a woman who can go in for imagine a woman who have never had sex before and for some reasons like infection have to undergo examination in the vagina. Of course, you shouldn't expect to meet such a person with hymen intact. Is that okay?
Mm.
Yes. So
Yes.
it's not only through your someone's normal activities, the person can have hymen you know being broken. Okay, so
Okay.
it's not only sexual intercourse. Okay, it's not only sexual intercourse. It can be due to several reasons. Is that okay? And that is why we are learning some of these things so that we get to be informed. Okay, we get to be
Mm.
informed that there are several factors that can cause the hymen to be broken, not necessarily sexual intercourse. Is that okay?
Yeah, I
Yeah.
also heard that some are born without a hymen. Is it true?
Oh, when it comes to abnormalities, okay, when it comes to abnormalities from congenital, everything is possible. Oh. When it comes to congenital abnormal, everything is possible. You can have someone who is born with 4 digits. You can have someone who is born with 6 digits. We have a condition where someone can be born without a head. We have conditions someone can be born without a kidney. We have a condition in the urinary system. We have a condition someone can be born and the kidney will look like a horse shape than the usual shape that we know as bean shape. Is that so? For congenital abnormalities, there it doesn't have a boundary. There is no limit to it. Okay, yes. So it's possible it can happen that someone can be born without a hand. It's possible. Okay. We
But
can even have
say,
someone who can be born without the urethral meatus. And that is why a midwife, you have to know these things. Because when a female child is born, your knowledge on reproductive system will guide you to assess. A midwife, what you say, or akwala no ye be man. Obe checking a glance penis na hwese urethral meatus ni wo hwa. Akwala bi wo ha ebe wo no. Na urethral meatus ni ntua ho, eni ho. Into home midwife no so anatomy nye good oh yeah wo akola no afa no na opepa ne ho. You didn't check some of these things. Okay, and imagine a midwife who does not know where we can locate the urethral meatus. How will you assess the newborn? Is that okay? How will you assess the newborn? Why you are not urethral meatus no why you are looking at the wrong place. Okay, and that is why we are learning some of these things. That is why you have to know the vaginal opening. Where is this supposed to be? The urethral meatus. Where is this supposed to be? Is that okay? So that you check, because we can have a child who will be born even without the urethral meatus. You can have a child who will be born with an abnormality. So you have to know all these things. It will help you with your assessments. Is that okay? And again, you should also know, because in future, oko pass catheter ama oba, oko pass, you are going to pass a urethral catheter for a female. You should be able to locate where the urethral meatus is, especially the gentleman. If you don't take care, you don't know the anatomy, you go and put the urethral catheter, insert it in the vaginal opening. Okay, so yeah, so this is a critical topic that you should take very serious. Is that okay? And learn it properly, not just for book and come and write exams. No, learn it practically so that you know. Is that okay? So that you know. Okay. Yes. So yes, that is it. Any question, please? Any other question?
say,
Yes.
please, at JHS, our science teacher told us that the girls that are into sports like high jumping and those stuff,
All
their
right.
high men is no more there. Is that true?
Oh, but we answered that already. That we have several factors that can cause hymen break. Is that okay? Not only girls that are in sports. Some women may lose their hymen just by normal walking, just by normal activity, not necessarily sporting activity.
And
You may
bicycle
also
riding.
you may also encounter someone who is also riding bicycle who would end up having an intertiming. So the factors are not fixed factors that once you are going to ride a bicycle, hymen should be broken. You can have someone who may be engaged in those activities, hymen will be intact. You can also have someone who may be engaged in those activities, hymen will be broken. Is that so? Yeah, they are not fixed factors. You can have someone who, through their normal activity at a point in their life without sexual intercourse, they would have their hymens being broken. Is that okay? So we have several factors. You can have someone who may go for an examination from maybe a condition or an infection, and because of the procedure that will be done, would have the hymen being broken. Is that okay? Yes. So we have several factors. Someone too may have the hymen being broken by insections. They may be insecting things there. Do you get it? So
Okay.
that all. So we have several factors that can cause a hymen break. Is that we have several factors. You can have someone who will not engage in anything, who is not into vigorous physical activity. Okay, but look at it. The concept of being, I know you are so enthused in asking these questions because of the concept of being a virgin. The concept of being a virgin is not just about hymen. Is that okay? Understand it well. Okay, that is a subject for social things. But the concept of being a virgin is not just about the hymen in terms of anatomy. Is that okay? And I think these are topics that you people know already. Okay, yeah. So being a virgin does not necessarily mean you have an intact hymen. It's simple that you've not had a sexual intercourse before in any shape or form. Is that okay? Yes. So that is the concept of being a virgin. Okay, and that is a different subject altogether from hymen as, hymen as a structure in the reproductive system. Okay. All right, that is fine. So I think we've done a lot with the female reproductive system. You people like the female reproductive system a lot. You've asked a lot of questions. Okay, so we have the prepuce, we have the clitoris, we have the frenulum, we have the urethral meatus. Okay, and at the right side of the urethral meatus, what gland is there? At the right and left side of the urethral meatus, what gland is there?
The paraurethral gland,
Or
the
or
skin
The skin
gland,
gland.
the skin's gland. Okay. Then we have the vaginal opening. At the right and left side of the vaginal opening, what gland is there?
the Bartholin's gland,
The Bartholin's
Yes,
gland.
ma'am.
Okay, the Bartholin's gland. And then here we have the faucet. Then in between the faucet and the anus, that region, what is the name? In between the faucet and then the
peri,
anus.
Perineal
Perineal
body.
body.
peri,
Or that is what we call
Yeah, what?
perineum. That is what we call perineum. Either you call it
Perineum.
perineal body or perineum. And the midwives, this particular structure should interest you because when in future a woman is during delivery, labor, and you want to do, we have something we call episiotomy. Perineal body mu no mutwafa. Omutwa efi faucet ni mu fi asia ba perineal body no. Uria no was suture ne back. Suaye. Okay, if you're a midwife, you're a student, now is the time you learn those things. And in future, we can hand over our wives to you, having assurance that you'll
Yes.
be able to do a good work. Take these things serious. You see, these things, take it personal. Because in future, Michael, the Nigeria Beshonsa, you've done the delivery. Why a episiotomy? One who suit you because you didn't learn the anatomy well. Michael and you, he will not be happy.
Salary. Farouk.
Okay, so take some of these things
Is it
personal.
who is
These are critical
Farouk?
things you have
Farouk.
to take seriously.
Look
Learn
man.
how to do them.
I'm just
Get
a look
closer
man.
to your instructors. Let them teach you how, because these are
Osman.
the
Osman.
practical things you eventually end up on the wall to go and do. Oh, wow, banana, I'm an hour. Until me, if she is pushing, it's not coming. You can do what we call episiotomy. Now, my chat, perineal body, ni mo abase. Send a baby, then now the baby can now come out. Inti one sua we anatomy. Ubon se wakwa kutwa won chen ha. Wapura no.
Obedembia.
And they will sue you, they will take you on. You didn't learn that. Oh, we learn in anatomy that if you are doing episiotomy, if you are cutting, you can't go and cut at the top. You can't come and cut at this side where the majora and the minora. You cut at the perineum. So that line no mun ye twa. And when you go, hello, can you hear me?
yes, sir.
Yes, sir.
Good.
Yes,
So
please.
now,
We can hear you.
you know. So now, basically, you know the male reproductive organs and you know the female reproductive organs. So the male reproductive organs, the testes, the epididymis, the vas deferens, the seminal vesicles, the prostate gland, the bulbourethral glands, the
The
penis, the
penis, the
urethra, and the
urethra, and
scrotum.
scrotum.
Then we come to female. When we ask you, we can ask you in exams, mention 10 female reproductive organs and structures for 4. No one so about vulva, cervix, uterus, vagina, ovary, fallopian tube. Do you get it? You can even talk about we mentioned the uterus, the cervix. You can talk about the other organs like the paraurethral gland, the Bartholin's gland. So if I ask you, mention 10 female reproductive organs and structures. Okay, you can talk about the vulva, you can talk about the cervix, the uterus, the ovaries, the fallopian tube, the parauteral gland, the Bartholin's gland, the faucet. The faucet is not an organ, but it's a structure. Meaning everything that comes into your mind from the structures in female productive organs and structures, write them. Okay, so learn to pick up these things off head. Is that okay? Great. And get familiar with these diagrams. Learn how to draw them. Okay, it makes the learning even easier. Learn how, practice learning how to draw them. Okay, so every day you can say, today I'm drawing 3 organs. Today I'm drawing 4 organs. Is that if you don't practice, it will surprise you. Exams, you will not be able to draw anything. Is that okay? You will not be able to draw. Is that so? Practice how to draw over and over. Draw every day. You can do 4. Every day do 4. Every day 4. Every day 4. By the time exams comes, I'm telling you, you become a master. Okay, but if you don't do you wait a week to exams, you'll be shocked. You go to the exams, so you've forgotten everything. Okay, do it every day. Match it till the exams day. Every day draw. At least draw 4 every day. Draw 4 every day. Draw 4 every day. By the time the exams come, you become used to most of the labeling and most of the parts. Okay. All right. That's fine. So quickly, let's look at, so there's the male reproductive system. So the testes, the epididymis, the vas deferens, the seminal vesicle, the prostate, the bulbourethral glands, the penis, the urethra, the scrotum. So let's look at the testes. Okay, what's the function of the testes from our previous discussion? What's the function of the testes?
It produces the sperms and also the hormone testosterone.
Good. So the testis produces the sperm, and then the sperm, or what we call the sperm cell, and then the hormone testosterone. Okay, now basically the testis forms in fetal abdomen. Sakwalano senema mejema. Pregnancy no any do 28 week. Usually pregnancy gets to the peak 42 weeks. But Ninsena do 28 week and not testis not form. Sakwalano brand I prepared. Just say it may not be so mature enough to produce, mature or quality sperm. Okay, but by the time the baby gets to 28 week intrauterine, when we say intrauterine, meaning during the pregnancy period, or that is so in midwifery when you hear intrauterine, meaning whilst the baby is in the womb, the fetus is in the uterus. Intrauterine. Is that okay? So by 28 week, the testis has formed. Okay, but then they descend into the scrotum before birth. Okay, so the testis basically form by 28 week intrauterine life. But normally the testes have to descend into the scrotum before the baby is born. But you can have some children that the testes will fail to descend. Listen carefully. Under normal circumstances, yes, a testis, by the time I need saying due to say 28 week and say, your baby, the testis not formed that. When it comes to the testis, the actual home of the testis is the scrotum. A form or abdomen. But ansani ebe wo akola na babonten no. As a testis no. As a descend to scrotum nim ansani ya wo akola no. But we can have some children that the testis will not descend from the abdomen. Ain't in a midwife say a wakwala no ye bema so ne shwa no na she. Ese abatu ne de mua me mia ne den. Obe fele keka she abatu ni woman. You have to check because if it fails to descend, it's a disease. We call that disease cryptochidism. Cryptochidism. Say cryptochidism. Say
Cryptochidism.
cryptochidism. Say it again. Say cryptochidism.
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 Hey,
Good. Cryptochidism. So when we say
cryptochidism.
cryptochidism, it simply means failure of the testis to descend into the scrotum before pregnancy. We can ask you in exams. So
Before pregnancy.
cryptochidism is failure of the testis to descend into the scrotum before
Before birth.
birth.
Uh-huh.
Is that
Okay.
okay? Failure of the testis to descend into the scrotum before birth. That is what we call cryptochidism. Is that okay? What does that mean? Typically, the testis forms by the time the baby have gotten to 28-week intrauterine, but it forms in the abdomen. Before birth, we expect that the testis has to descend into the scrotum. But we can have some situations that the testis will fail to descend normally. And that condition that occurs is what we call cryptochidism, failure of the testis to descend into the scrotum before birth. That is what we call cryptochidism. Is that okay? Great. Then again, we have what we call, so if we have a child that is born with this condition, sometimes they can grow up and they experience infertility. Okay, they will become infertile. Is that because without that, it means they don't have the testis in the scrotum? Is that okay? Great. So as a midwife, when they give birth to a male child, please make sure you check for some of these things. Okay. All right. So for the time for their exams, I think I would like to end over here. Okay, I would like to end over here so that I